Happy new moon to all my trying to conceive couples all over the world. Welcome to my space. This is another new month for you to take a decision, for you to correct some things, for you to be informed of some things you've not been doing. If you have been trying to conceive for 1 year and above, and you are over 35 years and above, it might be a time that you need to take some fertility investigation. Why do I talk about fertility investigation? Because some persons, when they call me and they say, "Ma, I've been trying for 3 years and conception have not come," the first thing that comes to my mind that I ask, for the past 3 years, what fertility investigation have you done? To my greatest surprise, you hear many say, "None, ma, I've not done any. In fact, my message doesn't even come regularly," and you'll be like, "Wow," and you've been calm about it for 3 years. No, have you visited any fertility clinic? They will say no. So now this month of June, I want to get you informed about some fertility investigation that you need to do. If you have tried from 12 months and above and you have not achieved a result. Here are number 10 important fertility tests every trying to conceive couple should know. Number 1 is for the men, and that is semen analysis, where you check the sperm. So number 1 on my list is semen analysis, especially for the men, where we check the sperm count, the motility of the sperm, and the morphology of the sperm. Very, very important. Then number 2 test is anti-Mullerian hormone, that's AMH. Here we evaluate ovarian reserve and the egg supply. That is what this gives us. So we still have follicle stimulating hormone, luteinizing hormone, estradiol. This helps us assess your ovarian function and your ovulation. Then number 4 test, fertility test you need to carry, is progesterone. This is to confirm whether ovulation does occur or not. Then we also have Prolactin test to know the levels of your prolactin, if it does interfere with your ovulation and fertility. Then we still have thyroid function test. This is to discover thyroid disorders, because the disorders can affect conception. Then we have pelvic ultrasound scan. This evaluates the uterus, ovaries, and follicle development. Very, very important. Then another fertility investigation we have is HSG. This helps us to check the fallopian tubes if they are open. Some persons have not done this. Some people actually have a blocked tube, or the tubes that are not patent. Very, very, if you've been watching my videos in YouTube, I've made a video about fallopian tube. Very, very important. So another thing is infection screening, to identify any infection that may be affecting your fertility. Very, very important. There's need for you also do blood sugar and metabolic tests. Conditions like diabetes and insulin resistance can also impact on the fertility. Please, very, very important. And I want you to know this. Remember, fertility testing is not just for the women. Both partners should be evaluated to identify the possible causes and choose the best treatment plan for both. Follow Benita Fertility and Family Diary on Facebook if you're trying to conceive for more TTC tips, fertility education, and encouragement on your journey to parenthood. Thank you so much for watching, and please follow my page, because most of my videos I will be explaining the importance of all these investigations I have listed. Thank you so much for listening, for watching, and I love you all. Bye bye.